So again, this is Aron, Team Martirez, and I'm going to be discussing to you on how to properly don a PPE and how to properly remove it after you use it. So we all know that according to the Center for Disease and Control and World Health Organization, it is very important to know what is the proper way to actually don a PPE and how to actually remove it. Because if you're going to just have one misstep, it might actually be the cause of breach of contamination. So I'm going to discuss to you first on how to properly wear your PPE and how to put it in proper sequence order. So the first thing you need to do is to actually wear your gown. The gown actually protects yourself, especially from your neck until all over your feet or until your knees are where it can be able to go depending on the hospital protocol. But most gowns actually cover it up until your feet. These gowns needs to be very important because it actually is the first layer of defense to actually protect you from this kind of disease, especially we are facing now the COVID-19 pandemic. And make sure that this gown is going to be not covering your hands because your hands are going to be covered by another type of personal protective equipment, which I'm going to discuss later. After wearing your gown, you need to wear a shoe cover. A shoe cover covers your feet because sometimes some virus, according to research, that there's some disease or virus that can be imprinted to your shoes. And when you're going to remove your shoes later, you're not going to be noticeable that you have touched that virus, and after that you're going to be able to touch your body and it's going to be transferring into you. That's why it's very important to wear shoe covers, and it's one of the most mandatory things that is very forgotten by some of the hospitals. So it's very important to use shoe covers. Third is the gloves. The gloves needs to be worn in a very good way because you need to make sure that there's no tear, that there's no abrasions that's going to be noted because the gloves is very thin. Even though it's strong, some gloves are very thin, and this gloves protects you from touching and contaminating yourselves by not letting yourself touch in a very contaminated object that might have a virus or a disease. So how to wear your gloves? So make sure you're going to wear it first in your non-dominant hand. So I'm left-handed, so you need to wear it with your right hand. So make sure that you're going to wear it in a proper way. And after wearing these gloves, you need to make sure that you are not going to touch any part of your body because you've already worn it. So after you wear your gloves, according to the sterility technique, the most important thing is that all of the waist above is sterile and under is unsterile. So you've already put your gown, which is protecting your unsterility below, and your shoe cover, which is protecting your unsterility below. That's why it's very important to first put your shoe cover before your gloves, because it's very important to know that your next PPE is going to be your face mask or respirator. So now I have a face mask here. So this is not the recommended face mask because the recommended face mask is the one that has the different color with each other because it is the thing that separates apart from it that the one which is dark colored is going to be the outside and the one that is light colored is going to be the inside. But the most important thing for a mask is that first the color. Second is this one, the part where you're going to put your nose in. You need to find a mask that has this because when the mask does not have it, that means that the mask is not credible or is fake. So this one is very important to know and wear it because this is the one that tells us where to put our mask in. So you need to make sure that you're going to put your mask, and first you're going to clasp it in your nose. After that, make sure that you're going to put it slowly. Then some cross it, but there's literature that says that if you're going to cross it, the air is going to go inside it, like this. Look, see? If you're going to cross it, the air is going to go inside the mask. So it's very important to not cross it. So it's very important to just put it in your ears. Like that. Then adjust it below. Make sure that it covers all of your mouth, your nose. And make sure that you'll be able to see because that's very important. After that one, you need to wear your goggles or your eye shield. So this goggles or eye shield is very important because it covers your mouth or it protects you from when liquid is going to go inside you, especially during operations. So you need to wear your eye shield in the proper way. So make sure this is going to be above your eyes. Then put it in. Or some uses a face shield, like it covers all your face. So it's very important for us to know what is the proper sequence of donning this type of personal protective equipment, because especially right now in the pandemic, and it's very important for us future professional nurses to know this also. So I'm back, and I'm going to discuss to you now how to doff your personal protective equipment. Doffing is very important as donning, because if you're going to be having one misstep in doffing, then you're going to be having a big chance that you're going to be in trouble, because you might be able to contaminate yourself when you're doffing. So the first thing you need to remove is your gloves, because this is the most contaminated object during your time when you have wearing the PPE. So actually in hospitals there's double gloving, because they need to protect themselves more, and the thicker the gloves, the more safer you are. And of course, it's also very important because double gloving's main purpose is for you to be able to properly doff yourself in your personal protective equipment. So I'm going to show to you on how to remove the gloves, both on the first gloving and the second layer of gloves. So first, you're going to remove it using your non-dominant hand. So using this one, you're going to pick it using your fingers. Make sure that it's going to touch your skin, because it might be contaminated. So you're going to pull it through. After pulling it through, then after pulling it through, you need to make sure that you're going to crumple it in the other part of gloves. After that one, using this hand, you're going to insert it, because this is now clean part and the inside is clean. So you're going to insert your hand in here, and then make sure that you're going to invert it. After that, you're going to throw it in the proper place. After doffing your gloves, you also need to doff your gown. On doffing the gown, it's going to be very important that you're not going to touch the inside or the part where the you're facing, because it's contaminated. So in order to doff your gown is that you're going to put it here like that, and make sure that you're not going to touch the part that is in front of you. After your gown, you're going to remove your face shield if you have. So removing the face shield is also just like the same. So you're going to make sure that you're not going to touch this part, but rather touch it as back as you can possibly be, like this. After that also, you need to remove your face mask. So I'm going to show you how. So example, this is the face mask that I have. So don't touch this part because it's contaminated. So rather, you're going to remove it in here also. Then after that, you're going to fold it in separately, like that. Then throw it in the proper place. In the respirators, you don't need to fold it because the respirators are not foldable. Then after that, you're going to remove the shoe covers. The shoe covers are the one that protects your feet. So after removing the shoe covers, now you're going to remove your inner gloves. For example, I have the inner gloves. You're going to remove it because there's 2 layers of gloves. The main purpose is so that after removing all PPEs, you're going to remove the last part, which is the inner gloves, which is less contaminated than the outside gloves. And after that, wash your hands because it is the most important universal precaution in stopping the contamination of diseases. So this is Aron and Martirez, and I've discussed to you on how to doff the proper PPE. Thank you. So, I'm going to discuss to you one of the most important things that you need to learn as a nurse. The 5 moments of hand hygiene. So, I have remembered this for almost 3 years now, and I'm very happy with myself. So I just have this mnemonics 2B3T. So 2 befores, 3 afters. So that is very important for us to know this one. So the first one is before touching a patient. It's very important to perform hand hygiene before touching a patient because as a nurse, we have several patients that we are also seeing. So sometimes we are not able to know what kind of virus has that one patient we've seen before and might actually put at risk the person that we're going to see or a patient that we're going to see after if we're going to perform hand hygiene. Second, before doing aseptic technique. Aseptic techniques like inserting IVs, doing a catheter insertion is very important that you're going to perform hand hygiene. Even though we know that you are clean or most nurses are clean with themselves, it cannot be prevented that there's going to be some virus that is going to be putting in your hand. So we need to make sure that the patient is going to be safe all of the time. Third, after touching the patient. After touching the patient, you need to make sure that you're going to wash your hands in order to protect yourself and in order to protect the other patients you're going to see after. Fourth is after touching the patient's surroundings. Sometimes those patient surroundings has virus in it, especially if the patient has some type of contaminated disease or communicable disease that might actually worsen or hamper you. Last but not least is after touching bodily fluids. It's very important to wash or perform hand hygiene after touching bodily fluids because it is the most risky thing that is happening to you when you're going to be able to perform or going to see a patient. So that's the 5 moments of hand hygiene, and you need to remember it if you wanted to become a nurse. Thank you.